I'm Jim Kraus, Principal Investigator of the Spinal Cord Injury Research Program at the Medical University of South Carolina. And as part of our ongoing series, I want to share with you some findings from our research. And these are going to have to do with people that are ambulatory with spinal cord injury and the types of problems that can come up, or at least one very specific problem with depressive symptoms. So what we have on the board is what we call a mediational model. And simply stated, what this means is that we are looking at three separate variables or three separate factors that can relate to how someone does or an outcome. And what we have on the board is ambulatory status. And we in our research combined people into three groups. Those that are wheelchair bound totally, not ambulatory at all. Those that are completely independent of others in their ambulation. In other words, they need no help from another person to be able to walk. And those that are partially ambulatory, those that do need assistance from another person in order to be able to walk. And what we found out are the people that require assistance to walk, they had a higher depression score than either people that were in a wheelchair all the time or people that were fully independent in ambulation. And if you again look at the board, you'll see the arrows going from ambulation to depressive symptoms. But when we account for the pain interference, which is the extent to which pain interferes with activities of daily living, we find that the relationship between ambulation and depressive symptoms is minimized. In other words, the differences in terms of depressive symptoms between those that are ambulatory that require assistance, those that are non-ambulatory, and those that are independent and ambulatory, they tend to go away when we account for the differences in pain interferences between the groups. And specifically, people that walk but need assistance to walk from another person with a cord injury have much higher levels of pain interference, and this appears to be accounting for the reason that they have higher levels of depressive symptoms as well. The bottom line is that for everyone that's ambulatory with a spinal cord injury, just as anyone that uses a wheelchair, that ambulation is one mode of locomotion, and it needs to be evaluated based not only on the psychological need to be able to walk, but also, is that walking functional? Is it really helping the individual to accomplish their goals, to be happy, healthy, and free of complications that include pain and depression? And for people that require a lot of assistance from others in walking, a different mode of locomotion may lead to diminished pain and diminished depression. In other words, they may get better if they consider that alternative.